Welcome to CarePod, a safe place to educate, inspire, and renew the caregiver. Listen in with our host, Dr. Kipley Bell, as she interviews different experts along the caregiving journey.
So we've been talking about community a lot here on the Care Pod, and I met this gorgeous woman who reached out to say, hey, I am the business director, the director of business development for Town Square Adult Day Enrichment Centers and senior helpers, and I'd like to share more about our entity and our space and how we can collaborate. And I was so impressed on the facility, and we had a dynamic meeting offline. And I said, hey, you know what? We got to get you on the Care Pod, talk about the offerings that the centers provide, etc. So please welcome with me Lisa Tosti.
Oh, thank you so much for having me, Dr. Kipley. It's a pleasure to be here.
Yes, so nice. I'm big on friends and leadership and all the goodness, and I'm thankful to have you too as well. Thank you so much. So we always begin, our why, what brought you in to this geriatric space, if you will. So tell me about that. What took your path into leadership around the elder space.
Yeah, so, I always say my career choice is deeply rooted within my family. So I come from a lineage of healthcare professionals where I like to say I was practically raised in this industry. So from a young age, my mother, she would take me to work with her where she worked at an assisted living. And at the time, I did not know I was volunteering, but I would volunteer my time. I would paint nails. I would push the wheelchairs. And I just had this deep rooted connection with seniors. So over time, being able to spend my summers in those assisted living environments, I connected very deeply and created these bonds with the residents there. So I learned the ins and outs of caregiving and was able to interact with their caregivers too, their families. They showed me so much appreciation for just being there for their loved one. And it just like fulfilled my heart with so much joy. But the impact on dementia, like with dementia, definitely struck at home at my family. So, watching my great grandmother, watching my grandmother battle the disease of dementia and Alzheimer's, I really experienced firsthand the challenges that I faced, my family faced during those times. So, despite though all of those difficulties, I was just kind of driven by this desire to provide compassionate care for those who are in need. So I always say every time that I interact with a patient, with a member, with a client, with a resident, I always remind myself, as soon as I step in that door, Dr. Kepley, I say, I'm going to treat that resident, that client, the member, I'm going to treat them as they're my own family. So that's where I started, but then also my journey, it led me down to a path to post-acute care. So my father, he suffered since he was 19 years old with diabetes. This led him to multiple amputations, heart failure, and ultimately full-time caregiving for my family. So during his journey, we witnessed, and my mom, like I said, I came from multi-generational healthcare workers. We witnessed the fragmented healthcare system and we navigated that. And I knew after doing that, I wanted to advocate for others who are facing similar challenges that may not know everything that myself knows or my mom knows. So just This was really fueled by my passion just for improving the healthcare experience and overall. But also, lastly, I
No,
am a
take your time.
mother. Yeah, so I'm a mother of two teenage girls, and my why has definitely expanded um, to include inspiring the next generation and to stand up for their beliefs and be a helping hand, reach out to those in need. So my family definitely continues to be my driving force behind my dedication to making a difference in the lives of others.
Yeah, and that's I resonate with you so deeply on those points because it's not like, "Hey, I thought this would be a cool job helping people." Those are those leaders, right? But it's saying, "Hi, I've gone through this painful experience, watching these icons in my life succumb to the frailty of an aging, dysfunctional brain. And how
Yeah,
how can I support that?" And it makes you more of an authentic leader in the space for those that you care for that are not your own. And I think
absolutely.
that's tremendous. I really do. It's
And,
tremendous.
I look
So
back
you
at I
no,
look
go ahead. I'm
back at
sorry.
my grandmother when she was in long-term care because eventually we did have to place her with an Alzheimer's diagnosis. And my grandmother, she would play bingo, and she knew that I loved Kit Kats my entire life. So every time I would visit her, she would have a bunch of Kit Kats for me, and she might not remember my name, but she would hand me over those Kit Kats. So it was so
Wow.
impactful, trying to really understand the disease and having that compassion. It's so important.
That's it. It's like, my own mother, her circadian rhythm is off because her nights are her days and her days are her nights
Mhm.
being, working as a night nurse for decades of her life. So
Right,
she's often that one to, wait till I key in that door, at the wee hour of the morning coming in from the hospital. So it's those subtle ways of love that doesn't die, right? And
right,
to really to bottle those moments because they do become few as the dementia progresses.
absolutely.
So yeah, it's so amazing. So you mentioned volunteering as a young child and so forth. um and also navigating a fragmented system, which is a theme, right? We are in the
Absolutely.
know. We're in the know as clinicians, yet we still have our own challenges navigating the systems, let alone people who have no idea. So take me through that. What do you think is working? What do you think isn't working in this space? And that we could do better.
So my experience, it's collaboration. We need to collaborate more. We need to collaborate as a whole on a higher level. We need to understand what is going on at the hospital on all levels of care. So, really being able to understand each individual as a whole, holistically, and being able not to just look at them as dementia, but they might have a chronic care condition where it does require, at our adult day centers where we employ physical therapists, podiatrists, primary care physicians like yourself. So it's really understanding that person as a whole, but also being able to communicate from the hospital level down to the adult day level. So just really understanding what is going on in the home. You can learn so much by somebody by just entering
Their
their home,
environment.
their
Yeah, yeah,
environment. It's incredible. So I think it's
yes.
just really understanding that person as a whole.
So tell me, I want to understand this concept of adult day, right? So
Mhm.
we are, we have these, activities and so forth within the nursing home environment, the long term care environment. But adult day says, hey, you can keep your loved one home with you, but you can offer respite and socialization through the adult day concept. Um, I've found that this is emerging more and more. So tell us specifically about this, about, the Town Square Adult Day Enrichment Centers and the offerings.
Absolutely. So, adult day, like I said, I come from skilled nursing, post acute care, where when we are discharging, we might be discharging or discharging home. And sometimes insurance cuts happen. We don't necessarily think about that care in between home, assisted living, and long term care. So, our adult day, Town Square Adult Day Life Enrichment Center, what we provide along with senior helpers is that it's that it's almost that interim in between home and long-term care. So we want to be able to provide that to their families, to patients that have dementia, Alzheimer's, or just need that socialization. So we're really dedicated to providing personal care solutions. So at Town Square, we are an adult day center, we offer those medical benefits as well. So, socialization and medical. So, we do put a very strong emphasis on socialization in order for our members to thrive. So, our center, we like to call it, I like to call it daycare point or adult day 2.0. So we are not that you do not walk in there thinking that you're in a medical facility at all. So it's 12,000 square feet. We have three centers in New Jersey. So we have our center in Brick, Marlton, and Princeton, but we're designed like a small town from the 1950s. So we have 13 different, we call them storefronts, but they're activity centers. So our members, they will visit each one throughout the day, spending about 40 minutes in each storefront. Very focused though on therapeutic recreation and reminiscence therapy, because let's face it, that's where our memories are the strongest. I actually did an activity with about 150 seniors the other day, reminiscence therapy, and bringing back those positive memories. We just had a Johnson and Johnson shampoo, and we all passed it around, and everybody. The one fella, he started tearing up because he said, "I remember my wife. She was so tired, and I used to give the baby the bath." And he said, "I used to put this in her hair." And it was just it's so rewarding. And you just see those positive memories coming through. So it is based on that reminiscence therapy model. But we also, also along with that, though, we have integrated and collaborated with professionals in our communities that can provide that higher level of care. So, occupational therapy, speech therapy, physical therapy, primary care. Who knew that a lot of individuals aren't assigned with primary care, but really being able to access that all in one spot, it provides that care continuity. It just provides that level of, I want to call it just comfort to the families, avoiding those transfer traumas, because I know you as a caretaker, me as a caretaker, it's hard being able to transport my father to an appointment, to 5 appointments during the week. So being able for our members to access podiatry, primary care services, psych services, geriatric care management, all on site in one
Amazing.
place.
Yeah, it's
It makes
amazing.
so much of
Yeah,
a difference. And then
it does.
also layering on support services for our family members, which is incredible. We work very closely with the Alzheimer's Association, Parkinson's groups, and we have probably about 2 to 3 support groups that are active every month. So really being able to to acknowledge all of those different care needs, not only for our members, but for their families as well.
Yeah.
And then
And
we have
so,
senior helpers too. So, I mean, we
yeah,
have
yeah.
those services that they're able to access. So, if they do need care in the home, we are able to deploy. We actually came up with these very innovative packages for our members and for our clients, where we call this like a combined care. So it's an on demand care package that's flexible. So they can actually, so if they needed to come to our center for, say, 3 days a week, and they need a care at home, we can provide that at a very low cost and flexible care option.
So tell me a couple things. So the activities, they are structured so that you have a recreational therapist, or tell me about the activities specifically and how
Absolutely.
they are structured for the members.
So we base everything off of the GEMS levels. So we do group our members based on, I want to say, cognitive abilities. So we do throughout the day, we are traveling through each room. So we have Rosie's Diner, where we provide continental breakfast, we provide a catered lunch, but we have the movie theater, Starlight Movie Theater, Craft Corner. We do a lot of programming. We partner, or next door we have. It's funny because we have a childcare program that's right next door, and they come over and we'll do interactive activities with them as well. As soon as you enter I always say, once you enter beyond those doors, you are transitioning back to the 1950s. So instantly, those memories are sparked. I can tell you about one of our members. Everybody asks me how I know so much about, we have a car at each one of an antique, gorgeous car
Which
at
is
each
so
one of
cool.
our locations.
I'm a
But
witness. So cool.
I know, but at our Marlton location, we have a 1955 Dodge Royale. It's three-toned, and I could tell you pretty much anything about this car because one of our members, he every time he enters our center, he said, "That's my car. It's a 1955 Dodge Royale." And it's three-toned. It's very rare, he says. And it just instantly sparks that positive
I
memory.
love it. I
I
love it.
know.
I love
It's
it.
really
I love it.
incredible. Everyone says, "Lisa, how do you know so much about this car?" I said, "My our member has taught me, and every time I see him, he just is fascinated." We actually have um, a volunteer that comes in from the Chrysler Club. He comes in and he works on the car, and it's very interactive with our members, and they just take it on
I
like it's
love
their
it.
own. They have those positive memories are sparked.
Yes, yes, yes.
Attention healthcare professionals. Are you looking to enhance your skills and stay ahead in your field? Look no further than our ACCME accredited CME courses. Whether you're a doctor, physician assistant, or nurse practitioner, our courses are tailored to meet your needs. Why focus on geriatric education, you ask? Because regardless of your specialty, geriatric care is becoming increasingly essential. As our population ages, the demand for competent healthcare professionals in geriatrics is higher than ever before. We don't stop there. Our courses also empower caregivers to partner with you in the care of your patients. We believe that by fostering a strong partnership between healthcare clinicians and caregivers, we can provide the best possible care for our elderly population. So join our impactful caregiving community today. Sign up for our ACCME accredited course instruction and take the first step towards advancing your career and making a difference in the lives of your patients.
Yes, yes. So is the schedule fixed?
It
So
is,
like,
yes.
okay, so Mondays you're going to do this, 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 Tuesday, so forth. Okay.
Yes.
Hmm.
We always make sure that we put two activities on there that are physical activities because we want to promote wellness. So
Hmm.
we want to be able to do something like we'll do cornhole in the morning, and then in the afternoon, we'll do yoga. So we're getting that movement, we're promoting wellness and really trying to engage there.
Gotcha.
So yes,
Okay.
we have our calendars planned out a month ahead of time what we're doing. We'll bring in outside entertainment. We're having a luau next week. So it's
Love
very
it.
interactive. Yes.
Okay. And so tell me too, the combination kind of on demand, speak to membership, speak to Medicare insurance, speak to, can a senior helper say, help the client help the member? So can you hire a senior helper that is dedicated to the member during their time at the enrichment center?
Absolutely. So that's one of our, we call it blended care. So we're able to blend home care services along with adult day services because when they go home, they might need assistance with making dinner, getting ready for bed. So we are able to help that individual do so. So we do offer those packages, and we like to customize care packages. So we know that one care package does not fit everybody. So we really want to customize those care needs based on what they need. Really trying to also, and I say this because I do come from that post acute care setting, trying to prevent any hospitalizations, noticing that change of care or that change of condition, really being able to identify that and keeping that continuity of care, being able to talk to each other. When our member comes in, our certified home health aide who is seeing the patient or seeing our member at night. She's like, okay, well, there's a little agitation going on, maybe there might be a UTI, but being able to almost, we want to call that letting our partners know that there's something going on, there's a change of condition, preventing any hospitalization. As far as funding goes, we are really happy to share before. So, long term care insurance, we were able to accept private pay and VA aid and attendance. But starting on July 1st, we have very exciting news to share. And I believe that this is kind of how we crossed paths as well.
Yes.
Uh, but so before now, there really wasn't much funding for adult day services and home care services for individuals with dementia and Alzheimer's. So as of July 1st, the Centers for Medicare announced that they will be funding care for individuals with those diagnoses. So that could be up to $2,500 a year or 80 hours of care. So this is a pilot program that runs for the next 8 years. We were very excited to be selected for this program. And This program, it is available for those who participate in Medicare. It does have to be Medicare as your primary, but have Medicare Part B services. And we have partnered with a telehealth company. So we are able to actually process those applications. It's a huge game changer for home care and adult day services. We are just so excited to be able to offer this to our potential clients, and clients.
Tremendous.
It's
Tremendous,
incredible.
tremendous. Absolutely. Yes. As a guide participant on my other brand Impactful Care as well, it's really an opportunity. I applaud Medicare to say, hey, we're going to refresh the clinical caregiver. We're going to refresh you in a way that you can support your families holistically. So
Yeah.
I think it's a beautiful opportunity.
And it's so much
Yeah,
more than just that 25, that the financial, curbing the financial uh, part of things, but it's a comprehensive care coordination. You're meeting with a neurologist, telehealth, so there are support groups are provided. So it is very comprehensive, and it provides, like I said, so much more than just funding,
absolutely.
resources to our families, to our clients and members.
Absolutely. So tell me about senior helpers now. So these are trained medical assistants, if you will,
Yeah,
in this
yes.
space. Tell me about that aspect of the business.
So, senior helpers, we are, I like to say, the leading provider in home care services. So, we offer personal care services, companions, live in care, and specialized programs for those with Alzheimer's and dementia. So, we have a senior GEMS program, which focuses on each individual. So, we really want them to be able to live their fullest lives and emphasize on their unique abilities and qualities by doing this. So, our caregivers, we are actually all trained to identify the different stages of dementia and understand that person as an individual and be able to provide that personal care and place those long-term care plans based on those GEMS classification systems.
So how does the an intake work? So, I'm Sally's daughter, and I think that this is a fabulous concept, and I'm interested in getting started. How does one begin the process?
So we have a care manager that would come out, do an assessment, meet with the patient, meet with the client and the family, and that's how we would get started. Then we do deploy our RN to come out and do an assessment. So really, I like to say that so senior helpers, we do a life assessment tool as well. So it's called Life Profile Assessment Tool. So which really provides the ability to develop effective care plans that lower the safety risk and increase autonomy. So, and improve the quality of life. So, we come out, we assess their environment. We will be able to predict the probability of them if they do not receive care, of them going back to the hospital or some sort of detrimental incident happening. So that is so important to senior helpers. It is a key tool that we use.
Beautiful, beautiful. So, what an amazing opportunity. Tell us the website where people can find you. And
Sure.
yeah, I think it's an opportunity to again showcase the platform. I
I
personally enjoyed the facility myself, doing a walkthrough, enjoying the car. It's a
Oh,
beautiful
thank you.
concept.
I did want to just quickly mention another program that we have rolled out recently. It is called Evermore Lifestyle Solutions. So we have three magnificent centers, and they are underutilized on the weekends. So we have partnered with a company called Evermore Lifestyle Solutions. So this is a company that specializes in adults with disabilities. So we are providing services through DDD goods and services on the weekends for for individuals with those needs that need services.
Beautiful. So
So
that's like a
um,
dedicated care separate from the
yes,
service. Beautiful
it
for
is.
those who are
Yes,
challenged otherwise.
yes,
Nice,
yep. So
nice.
we're able to really utilize this our centers in different capacities, which is wonderful. Yeah.
Yeah.
So taking away
You
from
know,
that medical atmosphere where they feel like a sense of
yeah,
belonging
constrained.
and purpose
Absolutely.
and happiness. Yeah.
Yeah, a different change, a change of scenery. Absolutely. So you beg the
Yes.
question that I failed to ask too, for the Adult Day Enrichment Center and senior helpers opportunities, do you have respite for those on the weekends? Or,
So
since you
through
had the
senior
ever,
helpers, we
okay,
absolutely do. So senior helpers, we absolutely do. And I always say collaboration in healthcare, it's the key to success. We work very closely with other organizations that do provide that overnight respite, and we're able to provide that continuity of care too. So, Town Square right now, we do not offer the services on the weekends, but we work with great partners that can do so.
so basically it's a collaborative effort, to use your term, and to also share your resources with your members. Um, and
Absolutely.
just to clarify, so there is a Medicare Part B benefit. For membership directly, is that private pay to be a member, or is that membership covered with Medicare Part B?
It is covered by Medicare Part B if there is a diagnosis of dementia or Alzheimer's and they're not in long-term care or hospice. So
Gotcha.
through there, up to $2,500, or there is private pay, VA aid and attendance, which we would walk through the entire process. Our process takes about 2 months compared to where it could take up to a year with the VA. And then there's also the private pay.
Gotcha. Gotcha. Okay. Well, what an amazing opportunity to share these resources with my CarePod audience. So
Thank
happy to
you.
have you join me today, and we look forward to future opportunities together to again share with my own community and of impactful caregivers as well. So I'm very happy
Yeah.
to have met you all.
Oh, thank you so much for having us. So it's a pleasure.
Yes, yes.
Great information right from the source. For more information on how to caregive like a boss, check out impactfulcaregiving.com. Want to be a guest on the show? Contact us at CarePod at impactfulcaregiving.com.